Welcome to Pregnancy and Birth Diaries. Today we will be talking about who will and who might be present during your childbirth. First, an obvious healthcare professional is, of course, a midwife, or in some cases, midwives. For example, during my first birth, there was a primary midwife with additional support from another midwife and 2 nurses. The second time, there was just 1 midwife for the whole process. Now, depending on a situation in a hospital, there might be an obstetrician present. An obstetrician is a medical doctor who specializes in managing high-risk pregnancies or complications, and also performs a C-section. They usually work in hospitals and have access to medical interventions and are trained in both normal and high-risk pregnancies and can handle complex medical situations. Now, I also want to quickly talk about OBGYNs. I think this profession is more common in US than in Europe. OBGYN stands for obstetrics and gynecology. So OBGYNs are specialists trained in both areas. For example, an obstetrician specifically focuses on pregnancy, childbirth, and the postpartum, while a gynecologist focuses on the female reproductive system's health, including issues that are not related to pregnancy. And OBGYN are basically 2 in 1. Moving on, a midwife, on the other hand, is a trained healthcare professional who specializes usually in natural childbirth. Now, in some hospitals, midwives have the autonomy to deliver babies without direct supervision from obstetricians. However, policies can be different between hospitals or even countries. Some midwives work independently and can manage the whole birthing process, like in my second case, while others collaborate closely with obstetricians. Midwives also provide medical care, do prenatal checkups, and offer postpartum care. Midwives work not only in hospitals, but also in birthing centers, birth houses, and also attend home births, depending on licenses and insurances they have. While researching for this video, I got curious about men who might be interested in this profession and how would their job title called. And apparently it's called male midwives or midwifery practitioners. I mean, although this field has traditionally been predominantly female, there are of course men who pursue careers in midwifery. I don't know how this is relevant, but I thought it would be interesting to know. Okay. Also, during childbirth, you can have a doula to accompany you. A doula is a non-medical birth companion that you hire. It's like hiring a grandma or auntie or a best friend who provides emotional, physical, and informational support, usually before and after childbirth, but you can hire her to be there for you during birth as well. They can offer support in breathing techniques during labor. They can offer a massage to comfort during the contraction pains and advocate for your birth preferences, among other things. So, while they don't provide medical care, they complement the support provided by midwives or obstetricians. Aside from obstetricians, midwives, nurses, and doulas, they could be other medical professionals present during your childbirth, and there could be anesthesiologists, mainly in case when an epidural or other pain relief methods are requested. An anesthesiologist administers an epidural or other pain medications and oversees the whole pain management. There could also be neonatologists or pediatricians present to provide immediate care to the newborn, especially if there are any complications or if the baby needs specialized attention right after birth. Also, there could be a lab technician in case if any tests or analysis are needed during the labor or birth process. And there also could be a surgical team in the case of a C-section. A team of surgeons, nurses, anesthesiologists will be present in this case to perform the surgery. Last but not least, I also heard that sometimes medical students can be present to observe and learn, but of course that would happen with your consent and permission, and if you don't feel comfortable, you can always refuse their presence. Now, the number and types of medical professionals present at your birth can vary depending on the hospital's protocols, your needs, and the circumstances surrounding the pregnancy and birth. Like I have mentioned, both times I had complication-free and natural births on the due date, and the first time I had 2 midwives and 2 nurses, and the second time just 1 midwife managed everything from start to finish. She even took me to take a shower and helped me to get dressed. At the end, she also managed in between delivering my son, caring for me and my newborn, to make a bracelet with his name. So she was just great at what she does, and she managed the whole thing on her own. So I think this is everyone who could be present during your childbirth, but let me know in the comment section if you had some other medical professional present during birth, and let me know why. All right, that is it for today. Stay well, and I will see you next time.